what we gotta do.
Legalize.
Yeah, what we gotta do.
Legalize.
Yeah, what we gotta do.
Legalize.
Gotta put them pushes right in the grave.
Situation is that in the year 2004, the Veterans Administration, the Veterans Affairs Department, spent $4.3 billion on disability payments to about 216,000 vets with post-traumatic stress disorder. $4.3 billion per year. That was hardly anybody from Afghanistan war and virtually nobody from the Iraq war. Now, there are loads of people coming back from these wars with post-traumatic stress disorder. And there's been a lot of scandals lately about how the Veterans Administration is not prepared to deal with them and is trying in different underhanded ways to misclassify people with pre-existing personality disorders so that they don't have to pay them disability for post-traumatic stress disorder. We have been able to start a study with MDMA for post-traumatic stress disorder that's taking place in Charleston, South Carolina. We have a study for MDMA for post-traumatic stress disorder in Switzerland that's treated a few patients, and we also have a study approved in Israel for MDMA for survivors of war and terrorism related incidents with post-traumatic stress disorder. What we've been able to show so far in our pilot study, it's not completed, but what we've been able to show is that MDMA can help subjects who are what are known as treatment resistant. In order to be in our study, people have had to fail on finding relief from SSRI medications. Those are Zoloft and Paxil. Those are the only medications that are approved by the FDA for post-traumatic stress disorder. Prozac and others are part of that same class. So people have to have failed on SSRIs, and then also they have to have failed on non-drug psychotherapy of a certain limited number of kinds that have shown to be effective in post-traumatic stress disorder. So once we take these treatment failures and administer MDMA-assisted psychotherapy, we've been able to demonstrate in almost everybody, not in everybody, but in almost everybody, dramatic reductions in their symptoms for post-traumatic stress disorder. We have a control group. It's a double-blind, randomized, placebo-controlled study with blinded independent raters who were not previously involved with us and who were not previously involved with psychedelic research, doing the evaluations. This is a study that is going to be able to withstand whatever scrutiny comes from the scientific community and from the FDA. We are now, in the next month, screening the 20th subject out of 20. We have one vet in the study. We've had a lot of problems with getting vets into the study because various VAs around the country have been reluctant to refer subjects to our study. And at the same time, we've been able to find one. His treatment is going to be starting next month. And we have a second subject who we've had to actually go to the FDA to ask for an exception to see if we could enroll him. He'll be subject number 21, Marine, Ranger, Commander in Iraq with substantial PTSD. But the reason that we had to go to the FDA, and now today actually, the IRB is meeting to evaluate whether he can be in the study. He's not a treatment failure. But the reason he's not a treatment failure is because the military did not offer him treatment. He's been classified as depressive disorder. He was not offered individual psychotherapy. We've already done some preliminary screening on him. He has major post-traumatic stress disorder of a severe nature, among the most severe of anybody in our study. The FDA has said yes, he can be in our study. The Institutional Review Board will let us know today. I believe that we are going to be able to show that if MDMA were available as a legal prescription medicine in association with psychotherapy for many of the vets coming back from Iraq, that we could help them avoid a lifetime of disability and a lifetime of suffering, and also save money of a massive proportion from the disability payments. Now, one of the subjects in the study was not a vet, but one of the subjects in the study said that she couldn't understand why this drug was called ecstasy. Because in a psychotherapeutic situation, the drug helps people to go deep into their feelings. And that can be very, very painful. And people work through the pain rather than avoid it. And it's really a combination of the MDMA and the psychotherapy, which can be expensive initially, but in the long run is much better off for everybody. The Washington Post Sunday Magazine is doing a cover story, 8,500-word story, on our MDMA PTSD study in the U.S. for November 25th, the weekend after Thanksgiving. And I think this is going to be introducing to many people in the Washington, D.C. area, in the Pentagon, in the halls of government, the potential that MDMA can offer to our vets coming back in a way that we owe them the most that we can do for them. Now, whether this potential will be something that the Veterans Administration will decide to help us support, I'm not sure. I'd be surprised, but we are going to have very strong pilot data. The study that we're currently doing will probably be completed in about 6 months or so, 6 to 8 months with all the subjects through it. We do a 1-year follow-up, and now we're looking at people after several years. The study has been going for a while. The gains seem to be lasting. The opportunity is there, and I just hope that the controversy over the non-medical use of MDMA will not make the Veterans Administration shy away from getting involved and looking at this as a potential treatment. Now, we are developing it in a non-profit context. MAPS is a non-profit organization, membership-based, supported by donations from members. We are trying to be able to market a drug, but it will be in a generic context, in a non-profit context, and we're open to anyone working with us or beating us to market. What we're trying to do is just integrate into our culture the use of MDMA as a prescription medicine, and also we do work with other psychedelic drugs to help with integrating altered states for a variety of potential beneficial uses into our culture.
What we gotta do?
Legalize.
Yeah, what we gotta do?
Legalize.
Oh, what we gotta do?
Legalize.
Gotta put them pushes right in the grave.